Life Management Science Labs would like to acknowledge that we live and produce this podcast on the traditional lands of the Wurundjeri people. We'd also like to acknowledge the traditional owners of the lands of our listeners and our international colleagues. We'd like to pay our respects to their elders past, present, and emerging. Hello, everyone, and welcome to Aging Less, the Longevity Science Insights podcast produced by LMSL, the Life Management Science Labs. We are champions of life management science, providing structured insights informed by science and inspired by practice on key aspects of conscious living. Each week, we bring you scientific and practical insights on each element with the expert knowledge of professionals in the field. I'm your host, Marie Stella, coming to your ears from Naarm, Melbourne, Australia. Let's learn together.
Hello everyone, and welcome back to the show. Today we'll be discussing dietary supplements, which are marketed widely and promise a myriad of health benefits from improving mood to boosting your immune system. But in what circumstances are they really necessary, and can they interfere with prescribed medications? Taking us through these complex health questions today is our expert, Dr. Candy Tsourounis. Candy is a professor of clinical pharmacy in the Department of Clinical Pharmacy in the School of Pharmacy at the University of California, San Francisco. She also serves as a drug use management supervisor at UCSF Health. Candy has over 30 years working in the area of dietary supplements. She is very passionate about educating the scientific community and the public about dietary supplements. She has authored numerous articles and has contributed her expertise to the development of dietary supplement competencies within pharmacy school curricula nationally and abroad. Candy has established a strong reputation in the area of dietary supplements and has been asked to speak on this topic at statewide, national, and international educational programs. So I'm very excited to learn from her expertise today. Welcome to the show, Candy.
Thank you. I'm excited to be here.
Me too. So can you start by telling us a bit about your journey to get to the career that you have now and what made you join the field of dietary supplements?
Sure. Well, part of my journey was really being in the right place at the right time. As you know, that is sometimes the secret sauce behind stumbling upon something that you're passionate about and that the timing is right. I was finishing my pharmacy residency training in 1994. And in the US, it was just about that time period where the Dietary Supplement Health and Education Act was passed by the US Congress. And in our country, of course, that allowed supplements to be its own category of products or nutraceuticals, if you will. And so in 1994, I was a resident, and a lot of healthcare professionals, pharmacists, physicians, nurses were now seeing these products being marketed, and there wasn't really good information about them. And people were asking, can I take this supplement? Is it safe? And so I was in a position to look up all of that information. I was in our drug information service, and that allowed me to look up journal articles and to investigate each of the herbal products that were being asked of me. And with that, I started to get so interested in it and began to really dig deep into the science and the use and how to guide people into using them the safest way and the most appropriate way. And it, as I said, it was just a timing thing, but that really sparked my interest as a pharmacist to say, why didn't we learn about these things in school at the time? Obviously now we're learning about them, but back then many health professionals didn't know. And it was up to a few people who had an interest to really educate people on what we know and what we don't know about these products. And of course, many have a long history of use too. So bringing the history forward is also important.
Yeah, that's so interesting. That's an amazing preface for our topic for today. So before we go further into detail, I'd like to get to know you a little bit better. So this is Have You Met Candy? I'd love you to answer these questions in just a few words and we will smash through them pretty quickly. So first of all, do you have a favorite book?
I do. One of my Well, I have two favorites.
Okay.
One of my favorite authors is Kristen Hanna, and one of her books that I'm sort of tied between two that are just at the top of my list. One is The Nightingale, and the other book of hers is The Great Alone, and both of them are just magnificent stories that leave me just in awe of the human condition and us as humans living on this earth and loving and just it's a lovely book. Both of them are. And then my other favorite, because I'm a scientist, is by Anthony Weir, and it's Project Hail Mary. It's a story of hope and life, and it's beautiful. So those are my two favorite books.
Amazing. And do you have a favorite movie?
That's really that's hard. I don't. I like a lot of different movies, but I think books are easier for me to get my head around and to sort of dig into that a little bit deeper. So I don't.
That's okay. And do you have a favorite podcast?
This is a tie. I love The Daily by the New York Times. And I also am a big fan of The Moth because it allows real people's stories to be shared. And that is something that I love listening to is people's stories. So, yeah.
Of course. And do you have a role model? This could be personal or professional.
A role model. I am really passionate, an advocate for Michelle Obama and all of the ideals that she stands by. And she's sort of a role model for me. I really admire her.
Yeah, that's a great answer. And do you have a favorite class that you've taken or maybe that you've taught?
I'm a big organic chemistry person. I used to love my organic chemistry classes, and my daughters now are just repelled by that idea. Mom, how could you possibly love organic chemistry? But that was how I became a pharmacist. And to this day, I really enjoy it. And I also do like physics, even though I hated it as a college student. I appreciate concepts of physics so much more now as an adult. It's really interesting how your perspective on these things change.
Amazing. Well, now that we've got to know you a little bit better, I'd love to dive into our questions for today. And we're going to get started with some just definitions and getting to know what we're really talking about. So can you just tell us, what is a dietary supplement?
Certainly. So again, my perspective is from the US, and I know in Australia and other countries, there's slightly different variations, but in general, I think we all share the same definitions. And a dietary supplement is something that we take orally that is used to maintain health. It is used for preventing, deficiencies and the resulting consequences of deficiencies. And it can be an herbal medicine, so it could be grown in the ground. It could be a cofactor, a vitamin, a mineral. That is sort of the widespread definition of what we mean by when we talk about a dietary supplement. And then, of course, combinations of those. So you can see vitamins with a mineral with an herbal, right? And all of those combined can still be a dietary supplement, or either of them alone.
Yeah, makes sense. And how do they differ from medications? This could be in terms of their use, their effectiveness, maybe even their regulation.
I think in general principles, the way that you can think of it is that prescription medicines are much more potent. And that's not to say that some herbal medicines aren't potent. It's just that prescription medicines are highly purified and concentrated, and we give them at a very precise dose. When you compare that to herbal medicines and to vitamins and minerals, those two have a precise dose, but in general, I guess you could say that dietary supplements tend to be more mild and not as potent. That's one very loose definition, and I say that because it's very broad. Obviously, the other difference is how they're regulated, with prescription medicines having to, in the US, prescription medicines are deemed unsafe until they're proven safe. So we have to have, the randomized clinical trials to show that they're safe. And we have, very rigorous studies to show that they're safe and effective. Whereas supplements, dietary supplements in the US in particular, and also within the Australian framework, they can be marketed to consumers, and it's only after there's evidence of harm that they can be removed from the market. And so it's a slightly different paradigm. But I should also say that, it sounds horrible. Oh my goodness, you're going to allow these dietary supplements on the market and just wait for people to get harmed. That's not really how it works. Usually the ingredient in question should have been either found in nature or have been used by humans in some other way in the past. So it's not like we're just randomly creating an ingredient and saying, here, take it. And if, something happens, we'll remove it from the market. That's not quite how it works, but there's some subtleties in that. But in general, with prescription medicines, they tend to go very rigorous, through very rigorous testing before they're made available because they're so potent. Whereas with herbal medicines and vitamins and nutrients, we sort of know where the general safety range is. And so we allow them to be used. And then should something bad happen, then the regulatory agency can remove them from the market. So those are the two, I guess, subtle differences between them.
Yeah, that makes sense. And so what is your definition then of longevity?
Yeah. So there are a lot of very popular authors right now who are doing a lot of work within the longevity space. And essentially what that is when you think of our lifespan, right? How from birth all the way to death, we have a period of time at the end of our life when we're going to be very, very ill, whether it's going to be immobile, we're going to have, life-threatening conditions. Maybe we're going to need assistance. Some of us might need a ventilator at the end of life. Some of us might need, hospice care. And the longevity concept is it's not just allowing us to live longer. It's that we want our healthy years to be longer. We want to extend the amount of healthy years we have so that the end of life is the shortest in disability, the shortest in discomfort, the shortest in, that really difficult time. So if we can maximize the healthy years, that is what we talk about extending longevity. So in this concept, you might say to yourself, if we could somehow prevent these chronic diseases from occurring in the first place, that's one way to extend our healthy years, or to minimize the impact of these chronic diseases, that too can extend our healthy years. And so that is sort of the discussion around what does longevity mean. And with dietary supplements is one way that people can really try to extend the healthy years. But of course, that comes with a lot of other changes that they need to make in their well-being in their life and healthy choices and such.
Yeah, well, that's actually my next question for you. What would you say is the relationship between dietary supplements and longevity?
Yeah. There is a lot of science right now underway trying to figure out what the impact is of dietary supplements on that equation, on the longevity equation. And what we're doing now, so the paradigm shift is that we started out thinking that, as we evolved, right, and we had sanitation and electricity and we have shelter, all these things allowed us to feel safe in our homes. And then, of course, we had the development of music and art and science. And now we're doing all these great things because we're talking about how we've evolved over time as human beings. we also now have plentiful food, right? And so nutrient deficiencies that used to plague, human beings for years and years, those have now been reversed because we have ample food, we have ample dietary supplements to replace deficiencies. And so now that paradigm is different in that we are now saying, well, we have ample nutrients, so how do we change the longevity equation? Well, the science is now looking at what are we doing at the cellular level, and might we change how the nutrients that our cells get when we're healthy in our healthy years that could then impact our later years towards the end of life. And there's a lot of talk right now about different supplements and different ingredients that people are recommending. We're not quite there yet. There's not that much robust evidence for all of these ingredients, but it's a start, and it's really bringing in the question of maybe there is something to healthy cells even when you have a nutrient replete diet, but maybe maximizing certain ingredients within our body, not just being not deficient, but maximizing. And so that is an interesting and compelling question. And then, of course, with that comes, how do we measure that? How do we assess that? That's going to take a lot of years. But it also goes back to something that we've all heard before, and I bet you've heard this too, and that is, get all your nutrients from fruits and vegetables and your diet. And that couldn't be more important now when we're looking at micronutrients, because as hard as it is to always eat a salad, those leafy greens have a lot of micronutrients in there. It's not just that we want calcium and vitamin K and, all the nutrients, it's the micronutrients. Those seem to be just as important, and they're in that balance in the whole food. And so, I could talk about this for days, but it is really exciting, and it's an area that we're just now starting to look at. We'll probably see a lot more about this in the next 5, 10, 15, 20 years.
Yeah, no, it's great to hear about the new research that's even just starting up. It's fascinating. And what would you say is a common misconception about supplements?
Well, there's a number of them.
Yeah.
The most common that I hear is that they're not regulated. And usually I use that as like the litmus test or a warning sign that the person who said that might not fully understand how supplements are regulated. And so it's not that they're not regulated, it's that they're regulated differently than prescription medicines. Just like I said at the beginning of this program, whenever I read a news story and someone says, oh, dietary supplements, they're not regulated, I don't recommend them, I immediately know that maybe they're not as informed on the subject. But they are regulated. There are strict standards about how certain herbs and supplements should be extracted from the plants. There are rules around how these active components are concentrated, how they're formulated into a pill form, and all the safety, excuse me, and all the safety measures that should be in place to make sure that there is batch to batch consistency and lot number to lot number consistency. And that there's no contamination in the products. You get where I'm going here, but I think that's the most common misconception. The other common one, and I think we're all guilty of this, present company included, is if a little is good, then a lot must be better. And so, hey, it didn't work when I took one, so I'm going to take 3. Don't do that. Try and follow the instructions on the label. They're there for a reason. And that's one of the most important tips I give people is just follow the instructions. If it says 2 capsules twice a day, 2 capsules twice a day, because that's how the supplement is intended to be used. And so that's what you want to do, is to follow the desired instructions.
Yeah, absolutely. That's fantastic advice. I'd like to now go into some of the risks and maybe also the roles that supplements can play depending on your situation. So, first of all, the risks. Are there any risks associated with dietary supplements? What are the most common ones that we hear about?
Yeah. Well, I think there's risks with anything that you take. And I'll start with a good example. I once saw this ad for a supplement, and the person said, take this supplement, it has no side effects. And when I heard that, I immediately said, nope, that person is a fraud. And here's why. When we take a dietary supplement to do something, right? We're taking it to change something in our body or to maintain something in our body. When we take a supplement to do that, it has to bind to a receptor in our body in order to elicit that change or to make that change that we're looking for. And in pharmacology, whenever you have a drug that binds to a receptor to elicit some effect, it has an equal chance of doing the thing we want, but it also has a chance of causing a side effect. And that is something that is at the heart of basic pharmacology, meaning that you can't only get the benefit without some side effect. Now, not everyone gets a side effect, but to say that something has no side effects is not 100% truthful. It's not accurate. And so what I always tell people is, this supplement is most likely safe, but there could be side effects. And a lot of times the side effects might be mild. So things like, stomach upset, diarrhea, constipation, those are more common side effects. Sometimes it's insomnia, or sometimes it's somnolence. Again, mild side effects, and maybe they don't happen in everyone, but it's important to know that they can happen. And so it's hard to know if you are the one that's going to experience that side effect. And so what's really important is, if you're going to go and start a new supplement, be very aware, right? As you're beginning the new supplement, be aware of how you're feeling. Be aware if you've eaten something when you took the supplement, or if you took it on an empty stomach. Maybe that could be the difference. Be aware of, is it in the morning or at night when you're taking it? Does it make you dizzy? Does it make you very alert and you can't sleep? These are the most common sorts of side effects you can think of. They tend to be mild, but you can see where, for some person, that a little bit of dizziness might be catastrophic, right? Maybe they get dizzy and fall and break something. That's not good, right? But in general, that side effect of feeling dizzy isn't necessarily an end-all be-all side effect, but for some people it can be. And so that example I use to just say that in general, supplements tend to be safe, but it depends on the person who's taking them and what their health status is and what their other medicines are that they're taking.
Yeah, absolutely. That makes sense. So, this podcast is all about longevity, really. So, as people age, nutrient absorption and dietary habits might change. How significant do you think dietary supplements are in supporting healthy aging? And are there any specific ones that become more important with age?
Certainly. Well, I'll start with a very basic one, nothing very, groundbreaking, but as we age, and in particular in our later years after age 65, I would say, and even for some people, it could be earlier, the amount of stomach acid that we produce actually goes down. And as our production of stomach acid, which is natural, it helps us break down food and medicines. So you can imagine, as if you are not producing as much acid, you're not going to be breaking down the tablet or the pill as well as you were when you were younger. And so one supplement that's really sensitive to that effect is calcium. And so for people who are taking calcium, including women who take it for bone health, it's really important that you encourage people to take the calcium with food. right? That helps generate acid in the stomach. And so that's a good example of that. Another one is iron, our iron tablets. Sometimes you'll see them made with vitamin C because the vitamin C helps absorb the iron. We always tell people to take it with food as well because of that acid production in the stomach. I mean, that's just one example of changes that happen as we age. There are many others, but I think that's two important examples that I think people can kind of connect with. The other important thing to remember about the stomach acid is we have a lot of people who now take acid blockers. So these are for heartburn or reflux, and a lot of these drugs suppress acid, and they do so completely. And so for that reason, it can lead to problems absorbing all sorts of medicines and supplements. And so for those patients, it's really important that they know that they're very careful about maximizing the absorption of the supplements that they take, including calcium and iron, but also other medicines as well.
Yeah, absolutely. Now, just earlier, you mentioned an ad that you'd seen about the side effects and there not being any. And I was wondering about the power of marketing. There's a strong public belief about the power of supplements and what they can do, but how much of this is actually just because of marketing? And does it align or conflict with what the clinical evidence actually shows?
Sadly, sometimes the marketing does conflict. Sometimes it doesn't. It's really compelling when you watch an ad, whether it be on social media or on television, and they just make it sound so good, right? A lot of times you'll see the ad, someone's wearing a white coat, suggesting that they're a doctor, giving you the impression that this is a reputable person who's recommending it. A lot of times with supplements, the majority of the research that's been done has been in animal models or in the lab. It's less likely that you will see randomized controlled trials with the supplement, but some do have randomized controlled trials. I say this just to begin the conversation, and you should always be thinking, hey, I just saw that ad. Did they say there were randomized controlled trials, or did they say evidence suggests? When they say evidence suggests, I immediately want to say, what kind of evidence? It's great that there's animal studies, but we're human beings, and we have a lot more of a complex metabolism, a lot of complex issues that are very different than what we see in the animal model, and certainly in the lab. And so I always want to know, are there randomized controlled trials showing improvement? Because there are some, when we look at omega-3 fatty acids, there are hundreds of randomized controlled trials supporting omega-3 fatty acids for a number of uses. So again, you have to listen very carefully to the ads and what they're saying.
Yeah, definitely a good warning. So I believe that you have studied drug supplement interactions extensively. Can you walk us through some of the most common or dangerous interactions that consumers or maybe even healthcare professionals might not always be aware of?
You bet. So in the world of interactions, there are two types that I want everyone to sort of think about. The first type is called a pharmacokinetic interaction. And basically what that means is when one drug speeds up the metabolism of another, or one drug slows down the metabolism of another. And this all happens within our liver because the liver breaks down medicines of all types, whether they're supplements, medicines, it doesn't matter. So when you have a medicine that changes how fast the liver breaks down other drugs, that's a pharmacokinetic interaction. And we have, I'm talking very broadly here. So I don't want to, paint the brush with just large strokes here. But one herb in particular tends to be very likely to lead to pharmacokinetic interactions, and that is St. John's wort. And when I say St. John's wort, I mean one specific type of St. John's wort, because it's not necessarily all forms of St. John's wort. And it also depends on the dose of the St. John's wort that you're taking. And what St. John's wort can do is it actually impacts how fast the liver can break down other drugs. And what St. John's wort has been known to do is we say that it induces the metabolism of other drugs, meaning it speeds up how other drugs are broken down. And so when you have another drug that you're trying to keep at a steady level, taking St. John's wort is going to bring that level down because it speeds up the metabolism. It speeds up how fast it's processed. And so we've had issues where people who are on transplant medicines to keep their transplanted organ, they lost the transplant because the medicine that they were taking was metabolized so quickly, the levels came down, they weren't enough to keep the patient where they need to be, and they ended up losing their organ. The other example was with birth control pills. So St. John's wort can interact with birth control pills. And if you're using hormonal contraception by mouth for pregnancy prevention, that's where you'd have to be very careful not to initiate St. John's wort because it can bring down the levels of the birth control pill. So I wanted just to share that to say that that's really that's like the poster child of drug interactions, is St. John's wort. So if you have someone who's listening and is interested in using St. John's wort, and you have a transplant, you're taking transplant medicines, or you're taking any medicine, check with your pharmacist, check with your doctor before starting the St. John's wort. That's the most important piece of information. Now, the other group of interactions is what we call pharmacodynamic interactions. And pharmacodynamic interactions are way more common. And here's a good example. So say that I am taking, a sleeping pill, whichever one, prescription medicine. And I also start taking melatonin to help me sleep. It stands to reason that now you're taking two things to make you somnolent, to go to sleep, right? And because both of those share that same mechanism of action, or they share the same effect, it stands to reason that you might feel more somnolent than you would taking either one of those, right? And so that overlapping effect is what a pharmacodynamic interaction is. And we see this a lot with all sorts of other supplements. Like if you're drinking coffee and you take a weight loss supplement that has caffeine, well, guess what? You're going to feel the effects of that because now you're taking way more caffeine than you bargained for, right? Overlapping pharmacodynamic interactions. So those are the two: pharmacokinetic, pharmacodynamic. And it's hard to know because there are, you can go online and search for herb drug interactions, but it can be hard to sift through the information. And so if you're ever unsure, always ask your pharmacist first, ask your doctor. They can always look it up to make sure that there's no interaction, make sure you're safe.
Yeah, that's great advice. And that is so interesting about how it impacts the liver. I would have had no idea about that. I mean, to be honest, I'm not someone who knows much about how drugs or food are broken down, but that's really cool. Could you tell us what are some signs or red flags that somebody might be overusing or misusing a dietary supplement? And how can they or how can people around them recognize this early on?
One of the most common things that I see is, well, first of all, I tell people that I'm going to be meeting with is, when you come to see me, I want you to go into your medicine cabinet and I want you to put every bottle of medicine, whether it's prescription or dietary supplement, put it in a bag and bring it in. I don't care if it's 2 years old. I don't care if you haven't used it in 3 months. Put it all in a bag. And then what I do is I'll go and put each bottle out, and we'll walk through what each bottle is for. If it's outdated, if it's not used anymore, then we'll talk about why do you still need it? Let's not keep it, right? And there's ways to dispose of those because we don't want to throw them in the garbage. We don't want to put them in the toilet because the medicines have a way of coming back into our water supply and in our soil. And so there's proper ways to dispose of expired medicines or medicines that we don't use. So that's number one. Then once we have the medicines and the supplements that people are taking, the number one thing I see is people will often use 5 or 6 supplements, and some will be combination supplements, and there will very clearly be overlap, meaning say they're taking 3 combination supplements, it's very common to see the same vitamins in each of the 3, meaning this supplement might have 5 ingredients, one of which is vitamin D. This supplement might have 2 ingredients, one of which is vitamin D. This supplement might have 10 ingredients, one of which is vitamin D. And then I show them, look, all 3 of these supplements have vitamin D, and now you're getting more than you need. So this is a good way to say, let's pare down what you're taking and eliminate this overlap of vitamin D in all 3. And let's find a different supplement that, you still get your vitamin D, but you don't get it across all 3 products. And so that duplication is so common. And I'm sharing that with you because I see it all the time, especially in my older patients who might not know that, that vitamin D is in there, or they may not appreciate why it's in there. And they may not know that they're exceeding their dietary intake on vitamin D. And I just use vitamin D as a good example, but there are many others that can overlap as well. So that's one example I would give you.
Yeah, that's a great example. So if somebody's thinking about taking a dietary supplement, what are some important questions that people should ask their doctors?
Absolutely. The first thing is to say, why am I taking it? So understanding the reason why. Is it to replace a deficiency? Is it to maintain health? Or is it to reverse something that the person is, experiencing? So knowing that is really important because knowing that will inform how long do they need to continue it. And I guarantee you, people don't ask that question. Do I have to take this for life? Do I have to take this for 3 months? Do I take this for a week? And so that is important to ask up front. So what is it for? To know how many tablets to take in a day. Do I take it with food or without food? Sometimes that's on the label. Sometimes that's not on the label. And then, of course, how long? Do I continue this, my entire lifespan, right? Health span, however long. Like for calcium supplements and bone health, that would be forever, right? But we don't ever say to a woman who needs it for osteoporosis, you need to take calcium forever. And it sounds daunting, by the way, to say you're going to be taking this forever. So that also is a consideration, is how we message that and saying, calcium is very important and you should take it, every day. Is usually what we say. We take it every day because it'll help keep your bones healthy. Some other questions to ask for is, will this interfere with any of the medicines that I'm taking? Will this interfere with the other supplements that I'm taking? Those are all essential questions to ask. And then the other thing that people should ask about is if they have pets or small children in the house, to be sure to keep them out of reach. Many supplements don't have those child safety caps on them. So really important to keep them out of reach because, they toddlers can get into them. We've had pets who've gotten into paracetamol or acetaminophen and have gotten into trouble that way. So really important to ask about that as well. And proper storage. We don't keep supplements and medicines in our medicine cabinet in the bathroom. Why was that created? It was not created by pharmacists because it's a very moist environment from the shower. So we try to keep medicines in a dry, dark environment, like a cupboard or kitchen cupboard, somewhere away from heat and steam, so that we preserve the longevity of the supplements and the medicines.
Interesting and good to know, because I'm sure a lot of people have a cupboard in their bathroom, like multiple cupboards that you put, soap in or whatever you put in your bathroom and just chuck it all in there. Don't do that.
Exactly.
Got to read how to store it correctly as well, because I know a lot of medicines do have it written on the label.
That's great. Yes.
Yeah. So given the marketing that we talked about before, how can people make informed, evidence-based decisions about what they should be taking?
Yeah. Well, the first thing to know is to really understand why you're taking the supplement. And you can visit the manufacturer's website for more information on the supplement. You'd be surprised how much good information there could be. Now, that doesn't always, as my lawyer friends, they say that doesn't always mean it's the truth, the whole truth, and nothing but the truth, Candy. I say, okay, fair enough. It's not everything you need to know, right? Because they're not going to put negative information on the website, but it's a good place to start, because on the manufacturer's website, it should tell you what the supplement is for, how to properly take it, what the ingredients are. That's another thing to know, is know all of those ingredients. And then if you're really interested in learning more, if you're very astute in looking up studies, you could look up studies for your supplement in question to see if someone has published a human clinical trial. Certainly that's, possible. And with AI these days, we can ask, AI, your favorite AI product, to show you evidence and to say, has this been studied in humans, to kind of get a sense of what does that evidence say. But really, I think the most important is to always engage in a conversation with your healthcare professionals, whether it be your primary provider or your pharmacist, who can really go over the details of the supplement that you have in question. And furthermore, I would also say that today we're starting to see branded supplements. And I have people who come in and they'll say, Candy, I'm taking this supplement. It's called, Health Pro. Is it okay for me to take? And so the first thing I would do is I'd go to the manufacturer's website to say, okay, what is this Health Pro? But let me tell you what you'll find. You'll find Health Pro Plus, Health Pro for aging, Health Pro for men, Health Pro for women, And so the first thing to ask is, which specific Health Pro product are you taking? Because that is a widespread issue now that has become very common. And without knowing the specific formulation, they can vary significantly. And so always asking about that and knowing how that formulation is unique for you, because there may be other ones too.
Yeah. Well, this has been a fascinating interview segment, and I'd like to move on now to our questions from the internet segment. I can imagine people from all around the world are maybe confused by the marketing we've talked about or have questions about supplements. So I've got a few here, and hopefully we can get your expertise. So my first one for you is there a difference in how the body absorbs nutrients from supplements and how it absorbs nutrients from food?
Yes, there is a difference always, right? However, even though there is a difference, that the supplements that you take will be absorbed. However, depending on the quality of the supplement that you're buying, that could be an issue. I'll give you a good example. Melatonin supplements early on were being marketed, and people were complaining, I'm just not feeling the effects of the melatonin. What is happening? Well, it turned out that the melatonin tablets were packed so tightly in the actual tablet that it never dissolved in the stomach. And so now you'll find that melatonin manufacturers market chewable melatonin for that reason, right? Because you chew it, it's readily available, you get it absorbed. So what I always tell patients is when they're interested in using a supplement and they don't quite know the reputation of the manufacturer, you can just take a glass of warm water and drop a capsule in there or a tablet in there, or you can put vinegar if you want to mimic, acid in the stomach. And if that tablet or capsule has not started to dissolve in a half an hour, that means that tablet or capsule might not have been made in the best way, right? Meaning that it's going to be solid all the way through your gastrointestinal tract until it comes out the other end. If it comes out the other end in solid form, that means that maybe you didn't absorb anything. So that is just an example of how sometimes the absorption of some supplements might be not having to do with the actual ingredient, but how it's made. And that's why it's important to choose a quality product. When you get your nutrients from foods, which is always ideal, I wish we could do that for everyone. What you're getting is not just that one ingredient. You're getting thousands of active components that we still haven't fully understood, right? We still don't know all of the thousands of active ingredients in, romaine lettuce or whatever it is that you're eating. But not only do you get nutrients, you get these other healthy ingredients like antioxidants, saponins, fiber. That's why we say a whole foods diet is so beneficial, because we're getting all these micronutrients that you really can't get in just a single dietary supplement tablet or capsule. And so that's why food is ideal. Can we all meet that? Sometimes no. It's really hard to eat a balanced diet, whole foods based diet, every day of the week. And so, and especially if you have special nutrient needs, you need to replace them with a capsule or a pill in a dietary supplement form.
Yeah, that's great advice. I mean, the importance of food is so important to understand, but for some people it might just not be possible. So it's good to understand that. Another person on the internet asks, and I know that we've sort of covered this, but what side effects should I be aware of before taking supplements?
It really will depend on the type of supplement you're using, but I alluded to it a little bit earlier. Most of the dietary supplement side effects that people might see really have to do with either stomach upset, nausea, vomiting, diarrhea, constipation, rarely allergic reactions, but that's, like I said, very rarely, sometimes rash. But those are the most common. If you are using a supplement that doesn't agree with you, like on an empty stomach, I would be concerned about feeling that nauseous feeling or that a stimulant-like effect, especially if it's rich in caffeine or a botanical form of caffeine. A lot of times people don't know what the botanical names are for caffeine. And so you pick up a product thinking, okay, this is great. And you take it and suddenly you feel like, oh my goodness, my heart is beating so fast out of my chest. I didn't bargain for, there's no way to know, right? So those are the most common side effects to look out for. Certainly if you've got a lot of prescription medicines, always check with your pharmacist before starting a supplement just to make sure that there's no interactions there.
Yeah. Fantastic advice. And finally, somebody asks, can you take multiple supplements at once? And are there any dangers in doing this?
You certainly can take multiple supplements at once. It will depend on what exactly they are. Ideally, you don't want to, as I mentioned earlier, you don't want to duplicate the same ingredients. So read those labels and make sure you're not repeating certain ingredients in every container. It's rare to see people experiencing a supplement interaction between different supplements. We don't usually see that, but I would be more concerned about absorbing each of the supplements. So sometimes it's good to stagger the doses of each of the supplements by 15 minutes, 20 minutes, an hour, just to ensure that your body is fully absorbing each of the supplements. But in general, again, it just depends on what it is. And I would, again, recommend they check with their pharmacist about that.
Yeah, that makes sense. So I have a similar question for you now, but we're moving on to our practices and habits section. What is a habit that you'd recommend practicing when it comes to taking supplements or managing your intake of supplements?
Yeah. Well, the first thing is if you're taking a supplement for an ailment that waxes and wanes over time. Like a good example is osteoarthritis. So people say, "Oh, I got a bad knee. It acts up all the time. I'm going to start taking the supplement." I say keep a diary. And in that diary, you write down when you started taking the supplement, what your discomfort pain level was when you began, and how it's changed over time. And for conditions that take a long time, sort of like that wax and wane, this week I had pain, next week I didn't. 2 weeks went by, then I had pain again, and then I didn't. It's hard to remember when you last had a flare up. And so keeping a diary will give you objective evidence of did it work or did it not work? So that's one thing that I would recommend. Another example is if you're taking a supplement to help support your blood glucose. Blood glucose can change. You need multiple readings to really see a trend, right? That too, keep a diary is really important. Other things is, be aware of changes that you're feeling in your own body that you might not ascribe to the supplement. Maybe it's you thought, I overworked myself and I have this pain now. Maybe it could be a result of the supplement. You don't know, right? So just being aware of how you were feeling, how your condition or your ailment has changed over time, that's also very important.
Yeah, that's really good advice to keep a diary. I'm sure some people find challenges in terms of actually remembering to do it. Do you ever recommend to patients to, do it regularly at a certain time or something like that?
Yes. Yes. One thing that's worked, and again, it depends on someone's schedule, but one thing that works is to take their supplement after they brush their teeth, right? Keep a reminder next to your toothbrush, whatever it is. You get up in the morning, you brush your teeth. It should become a habit that, I have to take my supplement and or my medicine at the same time. The nice thing about that is you can decide if you want to take it on an empty stomach right after you've brushed your teeth, or if you want to wait and have it with your morning breakfast. That will depend on what it is. But in general, I found that technique works. And the same thing can work in the evening, keeping it right by your toothbrush in the evening to remember to take your evening dose. That could be another really good strategy. And of course, now we all have our peripheral brains, which is our phones. And there's a lot of apps that you can use that you can set an alarm. You can have an app remind you to take your supplement. That's another really common way that people can remember to take them.
Yeah. This has all been fantastic advice, and I've certainly learned a lot from you today. I'd like to now move on to our open mic segment, which is where you can talk about anything that you're passionate about. It doesn't have to be related to our discussion so far, but it can be. So the floor is
Yeah.
yours.
Yeah. One of the things that I think we all need to think about more is really our approach to wellness. And one thing that I'm very passionate about is getting people more active. And I don't mean more exercise necessarily, because, when I say the term exercise, some people have this vision of somebody sweating on a treadmill, right? That's a horrible thing to conjure up. And one thing that I really want to promote is just getting more active. And that can look so different, right? Different for everyone. But maybe for you, it might be participating in a yoga class, once or twice a week. For some people, it may be, instead of walking their dog once around the block, walking it twice around the block. Small changes and incremental changes that we can do to become more active and more physically active can really make a difference. There's so much evidence now showing that simply walking can be very helpful in someone's overall health. We have this concept of, excessive exercise, high intensity training, aerobic exercise. Yes, those are all good things for the heart, certainly, and for muscles and the like. But we have to just start slow. And the way to do that is to start walking, start moving, not parking, finding the parking spot the closest to where we're going. Park far away, or take the stairs. Don't take the elevator, or ordering one serving of food, not double, or not going back for seconds. I think that will help us live a healthier and better life. And that's how I do it. And the other thing I'd say is find something that you enjoy. Maybe running is not for you, and maybe for somebody else, running is life, right? If running is not your thing, then find Tai Chi, or do yoga, or go for a walk, or do CrossFit. Whatever it is, find something that's sustainable and that you can do, and that brings you some sort of peace or joy in your life, because we all carry around this guilt of like, oh, I didn't exercise today. Don't have that guilt. Just walk, go for a walk. That's what I'll leave you with, because I think it's so important. We have very sedentary lives now in front of our computer monitors, and we drive and don't expend as much energy. So that's my final take.
Yeah, that's a fantastic final take. I mean, I always find it so interesting that doing something that you love and doing it consistently really builds up different muscles and just different endurance. Like, for example, I dance. And so I can dance for the length of a whole song or two songs. And I'm sort of jumping and moving and stretching my muscles. And it's quite a lot. And my endurance for that is a lot better. But can I run 30 seconds down the block? No, I can't. But
it's not for you.
It's not for me, but I'm still a very fit person because I'm still doing that. So it's really important to find something that you can really enjoy so that you can still cultivate that fitness. I think that's really great advice.
Yeah. And we just need to let go of the guilt too. Because, after a long day, you come home and you're like, oh, now I have to exercise. How am I going to fit that in? I don't know, jog in place or stretch or do something that, makes you happy. Yeah.
And I don't feel guilty for not running because I hate running, but I do feel guilty if I don't dance because I miss it because I love it. So I think it's really important. Great. Yeah. So we're going to conclude our episode now. That was fantastic advice all the way through our episode. If our listeners want to find out more about you and your work, where should they go?
Yes, I am on the UCSF website. It is www.ucsf.edu, and you can search up my name and you'll find about all the great things that I'm involved in, and a way to contact me.
Amazing. Thank you for that. So I just want to say again, thank you for joining us. I've learned a lot from you, and I really hope that our audience has as well. And I'll leave your links in the show notes for our audience to find out more. To our audience, thank you so much for tuning into this episode, and we'll catch you in the next one.
You have been listening to Aging Less, the Longevity Science Insights podcast produced by LMSL, the Life Management Science Labs. More episodes are available from 10 life management perspectives and can be found by searching LMSL on Apple Podcasts, Google Podcasts, Spotify, YouTube, and other podcasting apps available on your devices. If you enjoyed this episode, please rate, share, and subscribe to our channel so that other people can find it and we can continue to provide quality content. More of our work can be found on our website at longevity.lifemanagementsciencelabs.com, where you can join our movement. I'm Marie Stella. Thanks for tuning in.